Imagine if you, or a loved one, were suddenly diagnosed with prostate cancer. Take a second to consider how stressful this would be for not only yourself as the individual diagnosed, but also for all of those around you who love and support you. Upon receiving the diagnosis, your doctor would refer you to an oncologist, where you would be presented with a wide range of treatment options in accordance with the progression of your disease. Since cancer is characterized by an abnormal and unpredictable cell growth, cancerous tissue varies greatly from that of normal tissue. The severity of cancer is thus graded by assigning a number from 1 to 5 to the two most apparent patterns of abnormal tissue observed in a biopsy sample. By combining these numbers, a doctor would then be able to assign a Gleason score for the cancer and determine its level of aggressiveness depending on how abnormal the cancerous tissue appears in comparison to the normal tissue. The oncologist may also likely use the TNM staging system to stage the cancer based on how far it is spread from the prostate, either to the tumor, node, or metastasis stage. This helps determine the severity of the cancer and the level of risk that it denotes for the patient, or in this case, you. Your doctor is now able to explain a variety of treatments that you may undergo in order to tackle the disease. At this point, you are likely to feel overwhelmed and unsure of the most appropriate course of action. As well, you may be unaware that in addition to the treatments your doctor has suggested, there may be one offered elsewhere that has shown to be more effective. Unfortunately, prostate cancer is not an uncommon disease, and therefore, the hypothetical scenario I have just described could very well happen to someone you know. In fact, in 2017, there were an estimated 21,300 men diagnosed with prostate cancer. I believe that it's extremely important for individuals to be aware of all existing treatment options, whether they be offered in one's own province or not. Being informed of one's options for care means a greater chance of obtaining appropriate treatment and ultimately superior outcomes. When I first began my practicum with Prostate Calgary, they emphasized the importance of this information being available to the public. They too felt that this knowledge would help men make informed decisions and give them the opportunity to travel outside of their home region if they were aware of a more effective treatment offered elsewhere. This is why, for the purpose of my practicum, I was asked to research all of the different prostate cancer treatments available across Canada and how these may differ in each province or territory. Originally founded in 1993, Prostate Calgary is an organization that aims to create awareness surrounding prostate cancer while advocating for superior treatments and an improved quality of life for patients. Now that I have provided a brief overview of Prostate Calgary, I would like to focus on the work that I completed throughout my practicum. At first, I did not expect that it would be overly difficult to find answers regarding the variation in treatment options. Although, as I continued to conduct research, my assumption proved to be highly inaccurate. I began by reviewing the Canadian Cancer Society's website. Here, I found an extensive list of possible prostate cancer treatments, along with a clear and concise description of each option. That being said, there was no indication as to whether all of the treatments listed were offered universally across Canada. Treatments listed were active surveillance, surgery, radiation therapy, hormonal therapy, chemotherapy, as well as high-intensity focused ultrasound and corticosteroids. It is important to note that surgery and radiation were further divided into subcategories as listed here. Once I had a clear list of treatment options in mind, I chose to research the websites of regional healthcare administrations as well as those of non-for-profit organizations. However, the Atlantic provinces, along with the territories, did not have much to offer in terms of websites listing available treatments. Information was either very generic or extremely limited. Even for the provinces that I was able to find information for, the lists provided were often deficient in the sense that only main treatment categories were noted. Thus, the subcategories found for surgery and radiation were, for the most part, not listed. Since the internet was only slightly resourceful, I felt that the best way possible to find a clear list of available treatments would be by contacting individuals working in regional healthcare facilities or those a part of a prostate cancer support group. sent out an individual email for each province and territory, save for the Yukon and Nunavut, as I was unable to find an appropriate contact for these regions. Of the 10 emails that I sent, I received a response from 7. Although this approach seemed to be somewhat helpful, I was still lacking lots of pertinent information. With the information I had gathered thus far, I wrote a summary to describe the available treatments. I also began creating a series of checklist tables divided by the types of treatments. I then indicated which treatments were available by adding a check mark for the corresponding treatment and region, while marking an X for those that were not offered. For the time being, I left many boxes blank as I still do not have the answers as to whether these treatments are available in certain regions. These tables were created so that Prostate Calgary could eventually display them on their website. Although there is still lots of work to be done in order to identify all of the various prostate cancer treatment options available across Canada, I discovered something much more significant during the research process. Namely, the difficulty that I had throughout the course of my practicum indicates that there's a lack of uniformity in regards to how regional healthcare administrations are required to display their information to the public. By requiring all Canadian regions to provide a standardized level of healthcare information to the public online, many more individuals would benefit from the ability to take active steps towards improving their health. I would like to thank all of you who took the time to watch my presentation, and especially thank Western and Prostate Calgary for letting me partake in this practicum experience.